Hi, I'm Menaka Raman-Wilms, and you're listening to the Decibel from the Globe and Mail. Usually, when we think about sickness, we think of things that have gone wrong in our body. But as the pandemic has highlighted, so many other factors outside of us, things like our social and economic situation, also affect our health. That's the premise of social medicine, and it's what Dr. Andrew Boozary does. He's the Executive Director of Social Medicine and Population Health at the University Health Network, a group of hospitals in Toronto. And his focus, as a physician researcher, is how homelessness affects health.
The latest data that we have is that actually during the pandemic, it costs $6,600 a month to have somebody in a shelter. And then when you look at the cost for supportive housing at $2,200 to $2,500.
Today on the show, Dr. Andrew Boozary on prescribing a home and why he says that would benefit our healthcare system. This is the Decibel. Andrew, thank you so much for joining us today.
I really appreciate it.
I want to start by asking you about something you tweeted in January. You tweeted a picture of a Toronto City bus at night with about half a dozen people who had their bags with them, and it looks like they're sleeping on the bus or trying to stay out of the cold. And you wrote in this tweet, "Do not look away. This is Canada's failure on housing as a human right." How does tweeting this picture relate to your work as a doctor?
I think really what we've tried to really put forward within the pandemic about social medicine is how all of us are more connected, but all of the decisions and choices that we make as a system, as a society, these are the things that actually have the most dramatic impact on one's health and on our population's health. And so when we think about, the work that we have to do in medicine in terms of trying to diagnose a problem and try to do the best we can in providing the right therapeutics, it has been so clear now for decades that one of the most pathological things happening is that we are failing on housing as a human right, and that it has had a massive impact on how people are living, but also their health, every facet of their life. People having to survive homelessness is by and far the most devastating diagnosis. It's a terminal diagnosis that we've imposed on people with the policy choices that have been made.
So maybe you can help us understand, I guess, how exactly all these things connect. So if you could prescribe housing for some of your patients, how would that help them, but also help ease the burden, I guess, on the healthcare system then?
If you are someone who is chronically homeless in the sense of not having a place to stay or have been, surviving homelessness, your life expectancy is half as long as the general public. So people live to their 40s when the average life expectancy is about 82, right? And so this speaks to, again, of where we've seen the therapeutic needing to be housing, because this is about pathological policy. And so when we're looking at these prescriptions, housing is able to ensure that people can get supports to where they're at. They can have the stability to be able to actually, safely have their medications if need be, develop an actual life that they, want with their own choice. And I think the other piece that, we can talk a lot about the data and the therapeutics, but this is also fundamentally about human dignity. And in the pandemic, there was, some great responses across the country from, hospitals and community partners and, municipal partners to try to say, if people cannot distance, which they cannot in the shelter system, we should move people into hotels and ensure that the supports are there and people can have their own room and be safe to physically distance, especially as we saw this play out pre-vaccine. And that's where many of us felt like this is going to be a huge change and shift, because, the stories that I will never forget are people, in tears because they've never had their own bed and bathroom. And I was like, how are we going to go back to what we had before? I'm just saying going back to normal. I mean, normal has been fundamentally unjust.
You mentioned the shelter system there, Andrew. What have you seen that tells you that that system itself is not enough?
A shelter system is not a solution to homelessness the same way, food banks are not a policy solution to food insecurity. When the shelter system was established, it was about ensuring that people could have an emergency place to stay for a number of days or potentially a number of weeks. We now have, for the 8,000 people in Toronto who are surviving homelessness each night, over 25% have been homeless or underhoused or without housing for over 5 years. 60% of people surviving homelessness are racialized. When you look at 30% being refugees and newcomers. And we have to be clear about this structural discrimination that takes place, of the systemic racism that has marginalized and silenced and tried to deny, these voices and stories about what the realities have been. And there has been an active effort to try to always paint this as, individual failures or bad choices, and the onus is on the person. But when you hear these stories, when you work with people, when you allow that to take place, see that there's not a whole lot separating many of us of, being able to, try to rent or afford a house in a housing crisis from being underhoused or unhoused. And that it's not, the case of some moral failure. The moral failure is deeply embedded within the policies that we have chosen.
Andrew, let's turn to the system here. A major factor is money. How much would it cost us to house everyone who is chronically homeless?
I would push on policymakers and for us as the public, can we afford the status quo? How much longer can we afford to have tens of thousands of people in this country without housing? When we look at the economics in terms of how much it could cost, the latest data that we have is that actually during the pandemic, it costs $6,600 a month to have somebody in a shelter. And then when you look at the cost for supportive housing at $2,200 to $2,500, the economic argument is stark, the moral argument is there, and the health consequences are significant.
And these are costs for Toronto. I just want to clarify that's
yes,
correct.
This is the city of Toronto, data that has come out in terms of the costing. It's a major economic argument when you're talking about a 2 to 3-fold difference. And when you look at the healthcare utilization aspect, which about, the fact that our failure on housing as a human right is pushing people into emergency departments or buses to get warmth and potentially a sandwich and to feel safe. I mean, that is a massive failure from a system perspective. And when I was training in medical school, the view was always, so-and-so's back as a frequent flyer. And I think the other thing we have to upend and shift is, no, that's not about being a frequent flyer. We're underserving these patients. We're underserving these people as to why they have to come into an emergency department to have their basic needs met. You have to call out the fact that, when people say, well, we don't have the money. I mean, if we have billions of dollars to spend on highways, but not housing, we as a society, as people, as governments, are going to have to make choices.
The country is also facing a housing crisis too, though. I mean, the cost of a house, even the cost of rent for people in many Canadian cities, it's nearly unaffordable for a lot of people. I guess the question is, where do we draw the line of who we can help here? If we're helping a certain group of people with the cost of a house or a home, where do we draw that line?
Yeah, I as a physician, I don't like the line drawing part because my view will be we need housing for all, right? And I think, of course, there's going to be different scenarios and options for people, but we need to actually ensure that there's a preferential option for people who've been surviving homelessness, because they have been punished for years and decades. And to then say, well, they're not going to be a priority now. I mean, that is unbelievably cruel.
You are making a good point here, but I guess the sticking point for some people, maybe not someone who's particularly wealthy or anything, but who is working hard to scrounge together for rent and is paying for rent in a city that's costing them a lot, and then other people are getting housing for free. I guess that's the kind of the common criticism that might come up, that some people are getting for free what others are working really hard to try to pay for. And
it's right. As people throughout this who've been working and doing everything they can to pay their rent, to take care of each other, are in a situation where people who can afford, their third and fourth home are pricing people out of a market. And then there's been a complete market failure in, the punishment for people without housing. So I actually think we can't draw lines on this. You have to pull together around, people who have been punished around the issue around homelessness, needing to get the supports that are there. And that also means the supports need to be there for people who have been working and are doing the best. But it's also important, I think, to lay out that this isn't just about that people who are not working get free, quote unquote free housing, and people who are working get housing. People who are working are homeless. Children under 16 are surviving homelessness. So we have to disentangle and push back on this view and this perception that's been pushed out, that there's, again, this kind of moral line that if you're on this side and you've been working and you've been, quote unquote, contributing to society, well, you have the right to housing. But if you're not, well, maybe the shelter will do.
Obviously, you've done a lot of work in this area, and the UHN, University Health Network of hospitals here in Toronto, it's working on a project right now in the city focused on building a social medicine modular housing facility. What is this project about?
Yeah, well, when we look at what we've been able to do in the last 2 years is to partner with community organizations, community leaders, and the city of Toronto and the hospital network to dedicate some land that was there for the building of a 4-story apartment building that would have 51 units. And also ensuring, I think the part that makes it a bit unique is not only about the partnerships of how this, sort of has come to be, but the kind of supports that'll be there for people, both from the health supports and some of the social supports. When we look at, elements there again from, harm reduction and social supports to medical and nursing and sort of virtual health aspects. It's really drawing on the experiences that we've had through the pandemic with respect to a hotel recovery site that was there for people who are surviving homelessness. And one of the things that we're able to see for people who were in the shelter system, coming into the hotels, is that they had access to peer workers. They've had access to some medical and social supports that were there. And that's something that we're trying to build into and ensure that it's not lost in the pandemic with the social medicine housing units that are, hopefully to be up within this year.
And is this like a temporary solution, or how long will they get to stay in these units?
Well, it's to be, permanent. It's to be permanent housing. And again, in terms of where, people will need the units. And again, I think there's, the hope of where people may, choose to move at various times if there's different life circumstances. But this is really to be, a housing solution and housing option for people that has not been there.
You have mentioned funding for this issue before, and I do want to bring up that the federal government has a national housing strategy, and last year's budget committed $1.5 billion more to their rapid housing initiative. Is this enough to start making a real difference here?
Well, I think any of the investments to be sizable are going to make a difference. But I think, again, this is something where we need every level of government to be committed. No one level of government is going to be able to do this alone.
Just lastly here, Andrew, I think a lot of people might generally support this idea of not wanting people to experience homelessness, but a lot of people honestly might say that they don't want to live across the street from maybe one of these modular housing facilities. This is the old NIMBY argument, right? The not in my backyard. What would you say to people, in your own neighborhood maybe, who might not be supportive of having this kind of facility close to home?
When you think about what we've all been through the last 2 years, to then hear these sorts of arguments, it can really pain and enrage you when, for many of us working in the front lines of the pandemic, we would do anything to ensure that people could get safety from the virus, safety from all of the health risks that have been there for people who've been surviving homelessness. And as we are trying to get through this and thinking about all of the people that we've lost and people that we've lost in shelter spaces, people having to live outside, I think if there's one thing around the pandemic is we were able to see homelessness in ways that we just hadn't pre-pandemic because of the decisions people had to make to take care of each other. And I think, around people, having to live in parks. So, to me, you can't come out with the argument to say, well, I don't want folks living in the public park, they can't do that. And then when there's housing options on your block, say, well, that can't happen as well. Well, where would you like that to take place? And nobody makes those decisions around us when we want to move or rent or move into a neighborhood. For those of us who work in these spaces and see the real humanity, the strength, the resilience, the care that people have for each other who've been surviving homelessness, for neighborhoods to try to turn their back on that, I think that there's real consequences to it, and it's going to be people who will continue to be punished for no fault of their own.
Andrew, thank you so much for taking the time to speak with us today.
Really appreciate it.
That's it for today. I'm Menaka Raman-Wilms. Our producers are Madeline White and Cheryl Sutherland. David Crosby edits the show. Kasia Mihailovich is our senior producer, and Angela Pacenza is our executive editor. Thanks so much for listening, and I'll talk to you tomorrow.